If you spend just 5 seconds looking before you flush, you might save your own life, because colon cancer often shows its first signs in the toilet long before pain begins. Your stool functions as a daily biological report that reflects how well your digestive system and several internal organs are working, because it is the end result of digestion, absorption, microbial activity, and waste processing. As food travels through your gastrointestinal tract, nutrients and water are absorbed, while the remaining material is broken down by enzymes and gut bacteria, forming stool with specific characteristics. When this process runs smoothly, stool tends to appear medium to dark brown due to bile pigments, formed yet soft because of balanced water content, and easy to pass because intestinal muscles are coordinating properly. When something in this chain changes, the stool often changes before you feel symptoms. For example, if digestion is too fast, stool may become loose or greenish because bile has less time to change color. If digestion is slow, excess water is absorbed and stool becomes hard or lumpy, suggesting constipation or sluggish gut motility. The presence of mucus can indicate irritation or inflammation in the intestinal lining, while an unusually strong or foul odor can sometimes reflect malabsorption or infection. Gut bacteria also play a major role, since a healthy microbiome helps ferment fibers, produce vitamins, and maintain normal stool form. Disturbances in these bacteria from poor diet, illness, or antibiotics can shift stool patterns. Even hydration status shows up here, because inadequate fluid intake commonly leads to dry, difficult stools. What makes stool especially valuable as a warning signal is that it updates daily, offering repeated chances to notice trends rather than one-time snapshots like many medical tests. Observing it does not require expertise, only awareness of what is typical for your own body, since normal patterns vary among individuals. A consistent deviation from your usual color, shape, or consistency can be an early clue that something in digestion, absorption, or intestinal health has changed, sometimes long before pain or fatigue appears. This makes simple observation a practical form of self-monitoring that can prompt earlier lifestyle adjustments or medical consultation when patterns shift noticeably. Normal and dangerous stool can often be distinguished by paying attention to a few observable features that reflect what is happening inside the digestive tract. Healthy stool is typically medium to dark brown because of bile pigments that change color as they move through the intestines, and it is usually soft, smooth, and shaped like a sausage or banana, which indicates balanced water content and coordinated intestinal movement. It should pass without excessive straining or pain, suggesting that fiber intake, hydration, and gut motility are in a healthy range. In contrast, certain appearances raise concern because they may signal bleeding, blockage, inflammation, or problems with bile flow. Pencil-thin or ribbon-like stool that appears consistently can suggest that the passage inside the colon is narrowed, which may happen due to muscle spasm, chronic constipation, or in more serious cases, a growth that is reducing space. Black, tar-like stool with a sticky texture is particularly concerning because it can indicate digested blood from the upper gastrointestinal tract, as blood turns dark when exposed to digestive enzymes and acids. Visible red blood, whether on the stool or toilet paper, can come from hemorrhoids or small tears, but can also be associated with polyps, inflammation, or tumors, so it should not be ignored. Pale, clay-colored, or whitish stool may occur when bile is not reaching the intestines properly, which can be linked to issues in the liver, gallbladder, or bile ducts. Very greasy, floating stool that is difficult to flush can sometimes point to fat malabsorption, where the body is not properly digesting fats. Occasional changes can happen due to diet, temporary infections, or medications, but patterns that persist over days or weeks are more meaningful than one-time variations. Recognizing what is normal for your own body provides a baseline, and deviations from that baseline are often more informative than comparing yourself to others, because digestive patterns vary naturally between individuals. Regular observation allows early recognition of changes that may warrant dietary adjustments, hydration improvements, or medical evaluation when unusual features continue or appear alongside other symptoms like pain, fatigue, or unexplained weight changes. Bowel movement frequency is a practical indicator of how regularly and efficiently your digestive system is moving waste through the intestines, because the gut relies on coordinated muscular contractions called peristalsis to push material forward at an appropriate pace. For many healthy adults, having a bowel movement once per day is common, but normal can also include going every other day or even twice daily, as long as the pattern is consistent, comfortable, and produces a feeling of complete emptying. What matters more than hitting a specific number is knowing your personal baseline, since the digestive system is influenced by diet, fluid intake, physical activity, hormones, stress levels, and sleep patterns. When frequency drops and several days pass without a bowel movement, stool remains in the colon longer, allowing more water to be absorbed, which makes it harder and more difficult to pass, sometimes leading to straining, bloating, and discomfort. Chronic, infrequent bowel movements can also contribute to hemorrhoids, small tears, and increased pressure inside the colon. On the other hand, very frequent bowel movements or ongoing diarrhea may indicate that the intestines are moving too quickly, reducing time for water and nutrient absorption, which can lead to dehydration, electrolyte imbalance, and fatigue. Sudden changes in frequency are often more important than lifelong patterns because a noticeable shift can reflect changes in diet, medication side effects, infections, thyroid function, stress responses, or gastrointestinal conditions. For example, travel, low fiber intake, and dehydration commonly slow bowel movements, while certain foods, caffeine, anxiety, or gut infections can speed them up. The nervous system and the gut are closely connected through the gut-brain axis, so emotional stress can alter motility and change how often you feel the urge to go. Ignoring the urge to have a bowel movement repeatedly can also disrupt normal rhythms over time, as the rectum becomes less sensitive to signals. Paying attention to frequency helps you notice patterns early, making it easier to connect changes with lifestyle factors or health issues and decide when a persistent shift deserves professional evaluation, especially if it appears along with pain, bleeding, or unexplained weight changes. Daily habits have a powerful cumulative effect on intestinal health because the digestive system responds to what you do consistently far more than to occasional efforts. Drinking water regularly, especially starting in the morning, supports proper hydration of the colon, which helps keep stool soft and easier to move, since the large intestine constantly adjusts water absorption based on how much fluid is available in the body. When fluid intake is low, the colon pulls out more water from waste, creating hard stool that moves slowly and can irritate the intestinal lining. Fiber intake is another major factor, but it works best when increased gradually because fiber absorbs water and adds bulk to stool, stimulating natural intestinal contractions that move waste along. Soluble fiber forms a gel-like substance that supports beneficial gut bacteria and helps regulate blood sugar, while insoluble fiber adds structure and promotes regularity. Physical movement further enhances these effects because the intestines are muscular and respond to body motion. Walking, light stretching, and routine daily activity stimulate peristalsis, the wave-like contractions that propel contents forward. Even modest activity performed consistently can reduce transit time and limit how long potential irritants remain in contact with the gut lining. Fermented and fiber-rich foods also nourish the gut microbiome, the community of microorganisms that assist in digestion, vitamin production, and immune regulation. When these microbes ferment fiber, they produce short-chain fatty acids that support the integrity of the intestinal barrier and help regulate inflammation. Diets high in ultra-processed foods and low in plant variety can reduce microbial diversity, which has been associated with digestive discomfort and broader metabolic issues. Sleep and stress management play quieter but meaningful roles, since the gut and brain communicate through neural and hormonal pathways that influence motility and secretion. Chronic stress can alter bowel patterns by changing how quickly or slowly the intestines contract. Consistency is what turns these behaviors into protection, because the gut thrives on rhythm and predictability, responding best when hydration, fiber, movement, and balanced meals are repeated day after day, allowing digestive processes to operate under stable conditions that support regularity and microbial balance, while lowering strain on the system and reducing the likelihood of persistent constipation or irregular bowel patterns that disrupt normal digestive function. Colonoscopy is one of the most effective tools for preventing colorectal cancer because it allows direct visualization of the inside of the large intestine and rectum, where many cancers slowly develop over years. Most colorectal cancers do not appear suddenly. They usually begin as small growths called polyps that form on the inner lining of the colon. These polyps are often benign at first and may not cause any symptoms, which means a person can feel completely healthy while changes are quietly occurring. During a colonoscopy, a trained clinician uses a flexible camera to examine the colon wall in detail and can remove polyps on the spot before they ever have the chance to become cancerous. This makes colonoscopy different from many other screening tests because it is both diagnostic and preventive at the same time. Age is a major factor in risk, which is why routine screening is commonly recommended starting in mid-adulthood, with earlier screening for those who have a family history of colorectal cancer, certain genetic conditions, or long-standing inflammatory bowel diseases. The preparation involves cleaning out the colon so the lining can be seen clearly, typically using a prescribed liquid solution and a temporary change in diet, which many people find inconvenient but medically valuable for accuracy. The procedure itself is usually done under sedation for comfort, and most people do not remember it afterward. Risks exist, as with any medical procedure, but serious complications are uncommon when performed by trained professionals. The benefit comes from detecting changes at a stage when intervention is simple and outcomes are far better than treating advanced disease. Screening intervals depend on findings and personal risk, so some people may only need the test every 10 years if results are normal. Public health data consistently show that populations with higher screening rates have lower death rates from colorectal cancer, largely because problems are found earlier. Many people delay screening out of fear, embarrassment, or the belief that absence of symptoms means absence of disease, yet early colorectal changes often produce no warning signs at all. Viewing screening as a routine part of preventive health reframes it from something done only when illness is suspected to something used to maintain long-term wellness and reduce the likelihood of facing aggressive treatments later in life.